Welcome everyone to Diabetes Awareness Month, where we are raising awareness for both type 1 and type 2 diabetes around the world. We're joined today by Dr. Blake Platt. Dr. Platt is the Administrative Chief Resident in the Louisiana State University General Surgery Program. At 24 years of age, during medical school, Dr. Platt was diagnosed with latent autoimmune diabetes of adulthood, a type 1 diabetes that was once only thought to occur in children. Dr. Platt, thank you so much for being with us today. We're very excited to hear your story. Would you just start off by telling us a little bit about your history, kind of what led to your type 1 diagnosis, what kind of symptoms you're experiencing, why you actually decided to get tested, and what you had to do to confirm your diagnosis?
Well, sure. Well, thanks for having me. So it was a little bit interesting as far as what led to my diagnosis. So in medical school, we do this thing where we do like a health, kind of like a health screening. So we see what our patients do. And my fasting glucose was a little bit high. And so I went and got tested. But after my fasting glucose was high, I just kind of assumed that it was a mistake. And so me and my now wife, who is my then girlfriend, went out and we got a large pizza, kind of one of those simple glucose testers, glucometers from Walgreens with 10 strips. And we each got a large Coke, and we downed the Coke. We ate half the pizza, and we serially tested ourselves. And she kind of plateaued at a normal rate under 200, and I kept climbing to above 400. That kind of confirmed the diagnosis of diabetes.
Well, I would say so. From that, what was your reaction? And was there any kind of prognosis from physicians and doctors that you saw after that as far as the disease progression? And what kind of initial treatments did you have to undergo?
Sure. Well, as you mentioned, it's technically latent autoimmune diabetes of adulthood, which is type of type 1 diabetes. So diabetes comes in two types. Insulin comes from your pancreas, and type 1 diabetes is generally when your pancreas no longer produces insulin, whereas type 2 diabetes is where your cells do not respond to the insulin that your pancreas produces. So in my case, my pancreas was no longer producing enough insulin to keep up with my needs. Traditionally, this is commonly thought of as juvenile diabetes. It generally presents in children. However, seemingly more commonly, it's presenting in young adults in their 20s as this latent diabetes of adulthood. Initial treatment was just diet modification, although in general, this progresses to full type 1 diabetes. So at this point, I no longer produce any insulin of my own. And so kind of moving throughout the years, I started on low dose, long acting insulin, and then I had to add short acting insulin in combination with the long acting insulin to now I wear a pump and a glucose monitor to control my diabetes.
You mentioned this a little bit kind of in your answer, but how has your daily life changed since kind of all this started? What do you have to do now, especially with regard to glucose, with the pump, with the monitor, that kind of thing, and the insulin that you really never had to think about before?
So before my diagnosis, I didn't know how many carbs were in certain foods and things like that. And now I can kind of eyeball stuff and kind of tell how many carbs are in it, how much insulin I'm going to need for each meal. And then also just kind of playing out your day as far as, because I'm a surgical resident, so going into a long case, trying to figure out where I want my glucose to be before the case, so I don't need to scrub out and eat something in the middle of the case and things like that. So just little adjustments as far as kind of day-to-day glucose monitoring that some people have to do who don't have diabetes as far as just eating and things, but it's a little bit more fine-tuned in my instance. However, I think the most difficult thing that I have to deal with that most people may not be aware of is acquiring insulin and the supplies I need. And so it's relatively difficult to acquire insulin so I live in Southern Louisiana. There's from the time I fill my prescription to the time I get it, I have to fill it several days in advance so the pharmacy has the supplies that they need, because a lot of times they don't carry it for whatever reason. And I need to make sure that my script is up to date, because even though I am a physician and I have several physician friends, if the correct physician does not prescribe it, it costs several thousands of dollars a day for me to have my insulin.
Got you. Well, that's that sounds like something really tough that you really wouldn't have had to even think about before, for sure. And certainly a big hurdle for any diabetic, especially particularly those with type 1. Is there anything in your general daily life that you can't really do now that you could do before?
No, not really. I mean, the technology is pretty good. It's a little bit behind what I think general people would talk about just because of the FDA regulations. So it's kind of on par with mid 2000s Palm Pilot than like a current iPhone, is a decent way to think about it. But as far as daily life, not really, just the little adjustments that I do. The only thing I can't really do, as far as I know, is go to space and scuba dive. And then when I run fairly regularly, I can't run more than about 6 miles without planning ahead and bringing food, although I have ran a marathon in the past, but that took significant planning.
One of the last questions I have for you, I have two more questions for you, if you don't mind. The first is what is kind of the number one thing you would say with regard to the insulin situation as a physician that both as a physician and as a patient, that you would really like to see a change for diabetics that would really help everybody as far as facilitating being able to get the supplies needed in a timely manner in an affordable fashion?
Yeah, and so I think that's a really important point, and I think that a lot of people who don't routinely interact with the healthcare system don't necessarily understand, and that's physicians included, when you're on the patient side, and is that a lot of times it is not necessarily a patient's fault or lack of preparation that prevents them from getting the supplies that they need. A lot of times the system is, for whatever reason, working against folks for one reason or another. And I think that's something that we're starting to see change and hopefully continues to change in the future. But just an awareness of the difficulties in interacting with the healthcare system, even for myself as a physician, so I'm relatively aware of it, is it's a lot of times complicated and cumbersome.
Well, that going along with that, what would be the number one thing that you would want people to know, or as you want to tell people to raise awareness for diabetes, both type 1 and type 2? What's something we really haven't talked about today that you think people really need to know that they may not know already?
Sure, and I think the biggest thing is that it occurs in all walks of life. Type 2 diabetes is generally thought to be kind of choice driven, which isn't necessarily true. It's more genetic than type 1 diabetes. And a lot of these illnesses and a lot of these pathologies aren't necessarily choice driven. It's just a thing that happens to people, and it kind of is what it is. And so I think a lot of the narrative, especially about type 2 diabetes, is about choice driven actions causing people to need these medications, and therefore it's kind of their fault and their responsibility. And so why do I, as someone who doesn't interact with these people or have anything to do with them, why should I help them? Because it's their own choice, and I don't think that's necessarily the case.
Well, Dr. Platt, thank you so much for joining us today and sharing your insights, both as a physician and as a patient. We really appreciate you helping us bring awareness to type 1 and type 2 diabetes. Stay tuned, everybody, throughout the month for more great content we have coming your way on our social media platforms. Take a look at our social media. Make sure you keep up and follow us on social media so you don't miss any of the great stuff we have to raise awareness for both type 1 and type 2 diabetes, as well as our general normal content as well. Dr. Platt, thank you.
Thank you, sir.